Well, hello, everybody. Happy 420 day to you all. Thank you so much for tuning in. I wanted to talk to you today about medical cannabis. Medical cannabis has had a lot of wrong ideas about it, and so I wanted to set some of those things straight. I am practicing in Florida, and just to let you know, in case you're not from this country. Hi, Alicia. Thanks so much for tuning in. Hi, Patricia. Thank you. Anyway, yes, unfortunately, medical marijuana is not available throughout the United States. It's on a state by state basis. Some people, hi, Alicia. Some people have, in certain states, decided that they would like their residents to have the benefits of it, and in other states, they still haven't decided that yet. So each state is having a different situation, and I think, I'm so happy that in Florida they finally passed medical marijuana. It was tried to be put into legislation previously to the election in which it actually was, and it failed by something like one percentage point it failed by the first time, and the second time, which was in 2016, it actually passed. And that means that it was implemented in January of 2017. So you have to be a doctor who has undergone certification, that's what they call it, certification, to be able to, in essence, prescribe medical marijuana to patients. Now, that being said, I'm going to refine my terminology a little bit. They don't like us to say prescribe because it's still federally illegal, but what you are essentially doing if you're a certifying doctor is you're in the position of assessing patients who present thinking that they may be eligible candidates to decide whether they really are eligible candidates by the criteria that Florida has set. Now, that's another very confusing thing, is that not only do not all states have medical marijuana implemented, but each state that has it has a somewhat different criteria for whether or not a patient would be considered to be appropriate for that or not. So there are certain things that tend to be regarded as being sufficient in most, if not all, states, and then there are other conditions that may thought to be appropriate in one state and not appropriate in others. However, I can just tell you that since I've been doing this now for like 3 years, I can't believe it's 2020 already, and I can't believe that I started doing this in January of 2017. But, as somebody who deals with, hi Wendy, thank you so much for tuning in. Happy 420 day to you. As somebody who deals in holistic and natural medicine, sometimes, although I think natural methods are always the best unless you're dealing with an emergency situation, God forbid, in which case you might need some conventional medicine in a hurry. But unless you're in an emergency situation, I think that natural methods always work best. It's just that natural methods don't always work the quickest. So 2 things I have in my arsenal to actually help patients quicker rather than slower. Hi Robert, thanks for joining in. One of them is bioidentical hormones, which usually affect people within anywhere from a day to a week. Okay, so that's something that can enable them to have quick effects. And also medical marijuana, because once they go through the process and actually access the products, then their relief is usually, again, within days, if not actually the same day. So let me tell you a little bit about the process of applying for medical marijuana in the state of Florida. Now, of course, if you're listening from other parts of the country, all of this may not necessarily apply to your state. But in any case, this is how they do it in Florida. So you show up to a doctor that is certified to be able to order medical marijuana for patients. You're assessed as to whether or not you're an appropriate candidate. And somebody's saying they had great results with medical marijuana, and that just makes me so happy. Anyway, because it's natural, and one of the things that's so great about it, and I think I'll just mention it here, is that it is so safe. Nobody has ever overdosed on medical marijuana, or any other kind of marijuana for that matter, because cannabis does not depress the respiratory drive like opioids do and opiates do. So there have never been any marijuana overdoses in terms of something that would cause death. So the profile for this, the safety profile, is extremely good. And the worst that could happen is that maybe somebody would be a little under the weather for a while if they took too much. They might not be able to function as well. Certainly they shouldn't be driving heavy machinery or anything like that while they're affected by medical marijuana in a lot of cases. But maybe if the ratio of stuff that they're taking is not right for them, then maybe they could have some temporary negative reactions to it. But it's nothing that's going to kill them or hurt them in any lasting way, as opposed to many other medications that can be taken for some of the same purposes. So what would be some of the purposes that somebody would take medical marijuana for? Well, I'm going to just show you this book. This is called The Medicinal Power of Cannabis. Okay? This was written by a medical doctor, Dr. John Hicks, and I'll just show you some of the chapter headings in his book. The subtitle of the book is Using a Natural Herb to Heal Arthritis, Nausea, Pain, and Other Ailments. And his chapter headings are about the history of hemp, which hemp is also a type of cannabis, but it's really kind of a different kind. This herb has been around for thousands and thousands of years, and they have used it in many different places. In fact, the effects on relieving glaucoma were actually known as far back as ancient Egypt. In ancient China, they also used cannabis. And way back, whenever she was reigning, Queen Victoria actually received a prescription for a tincture of cannabis for her menstrual cramps from her royal physician. I wish that I could show you that slide, but I was attending a talk once where somebody showed us the actual prescription that the doctor wrote for that. And it makes sense too, because one of the things that cannabis can do is it's anti-spasm. So if a person has spasms or tremors or cramps, oftentimes cannabis can be wonderful for that without eating out your GI tract like other forms of non-steroidal anti-inflammatories. That's one of the other great things about it, is that unlike these other types of medications, it's not going to do damage to your gut. And of course, that's really important because your gut is very linked to your brain and your immune system. So that brings me to another aspect of using cannabis medicinally, and that is that there's a whole system in our body that we're just starting to find out about called the endocannabinoid system. And the endocannabinoid system is so complex and involves so many different related chemicals. I've heard it said that there's something like about 400 different cannabinoids to be found in cannabis, and probably there's more, because we've really just started researching it because of the squelching effect, let's say, that putting it on the Schedule 1 drug list, which the DEA did, that's in the same category as heroin, which means that category of drugs that is highly addictive and has no redeeming medicinal value. Okay, I think that that was a real error to put it in that category. But you see, if you look at it from the standpoint of money, there's a lot about cannabis that would really scare big pharma. Why? Because there are so many different categories of illness that cannabis can be helpful for. And within each of those categories, there are many drugs that big pharma has put out that compete in essence with cannabis. But all of those drugs tend to have a safety profile that is nowhere near as safe as cannabis. And so, from a financial standpoint, I don't think that they really want this coming out there, and there's always been a lot of pushback from government and from other pharmaceutical companies that are trying to, prevent people from having access to this on an adult usage basis. And when you look at all the different categories of things that cannabis can help, it can help pain, it can help sleep, I should say it can help with insomnia, okay? It can help with anxiety, it can help with depression, it can help with muscle spasms, it can help with seizures, it can help with certain types of neurological conditions, such as multiple sclerosis. There are so many different things that it can help. However, that being said, it makes a big difference what kind of cannabis you're using. So here's two very important differences between medical cannabis and, let's say, cannabis that you get off the street from your friend or from informal sources. Number one, when you have those informal sources, you don't actually know exactly what you're getting. You're hoping that it's something good, but you really don't know what it is, both in terms of its content of CBD and also THC. So let me just explain to you about those two chemicals, because those are the two most well-known chemicals that are in cannabis, and they are phytochemicals, which means that they're natural plant chemicals. Both CBD and THC are anti-inflammatory and protective to the nervous system. Let me say that again. Both CBD and THC are anti-inflammatory and protective to the nervous system. That means that they are good for the brain and the nerves, and they diminish inflammation, especially in the brain and nerves. Why is this so important? Well, for issues like, for example, seizures, or for nerve damage or pain, this can be huge and in a very non-toxic way. So the main difference between those two chemicals is that CBD, which stands for cannabidiol, won't make you high, whereas THC, which stands for tetrahydrocannabinol, can make a person high if they have it in sufficient amounts. And an interesting thing about CBD is that maybe because it can occupy some of the same receptors that THC does, I don't really know about that, but that is one possible mechanism by which this could happen. CBD actually tends to dampen down the getting high effects of THC. So if you take the same amount of THC by itself, a person could get higher than if they took that same amount of THC but with an additional quantity of CBD added to it. So I just wanted to show you the medical marijuana use registry. This is, let's see if I can do this now. Still haven't located my selfie stick, but please bear with me. I don't know if you can see that. Yeah, you probably can, hopefully. Okay, so this is a site on the internet where it serves as a central meeting place, in effect, for doctors, patients. Hi, Debbie, thanks for joining in. Doctors, patients, the state, and the dispensaries. So, Let's say that a doctor sees a patient that they think is a good and appropriate candidate for medical marijuana because they have one of the conditions that is, considered appropriate in Florida to receive medical marijuana. After the doctor enters them into the registry, then that allows the patient to apply online for a card from the state. This is a license to use medical marijuana that has to be renewed annually with the state. Once the patient has had their application approved, then they need to come in for a second visit in which they are going to have a physical exam done. They're going to sign a waiver, something like a 7-page waiver, and I kid you not, for all of the different things that they have to acknowledge that they were told about medical marijuana. And then the doctor enters their orders into the registry. Once those orders are entered in, they can be seen by any dispensary. So for example, let's say that a patient goes to a dispensary and orders a certain amount of the product that they are eligible to get. The dispensary looks in the registry on their patient profile, sees what the doctor has put in for orders for them, and then when the patient buys a certain quantity, the dispensary then subtracts that from the total amount that is available for that patient for a certain given time period. So, one of the things that can be very confusing to patients in Florida, I have noticed, is the difference between renewing your license annually with the state, which is something that you do online, and having a certification visit with a doctor. In Florida, and now this only applies to Florida, mind you, because each state where there's medical marijuana has a different regulation in terms of how often patients need to see the doctors. In Florida, it's every 7.5 months. So that doesn't really make too much sense to me because some of the indications like cancer, okay, I forgot to mention that one, but it's very important, not only for palliation, but in some instances even for cure. So we won't talk too much about that because not too much research has been done about that in the United States. Probably the leading country in the world right now doing research on marijuana is Israel. So they've done a whole lot more research than we, and maybe they will have some studies about how to utilize cannabis in terms of actually healing cancer. But there is something named Rick Simpson oil, and if you all are interested, you should actually go to YouTube and search Rick Simpson oil. And this is about an oil that has been extracted by somebody of that name. Hi, Kathy. Thanks so much for tuning in. And this guy, Rick Simpson, has actually, been able to help people with their cancer using extracts of cannabis. And speaking of extracts of cannabis, it's such a complex and interesting plant. Besides the two different cannabinoids that I've mentioned, which is CBD and also THC, there's a whole bunch of other cannabinoids, and in places like California, where they've had medical marijuana since 1996, they know a lot more about various different cannabinoids like THCA and CBA and CBG. But we're just starting to learn about those things over here in Florida, and even things like the presence of terpenes. Okay, so Kath wants me to say that I should be sure to mention the RESL Rick Simpson oil because there are many fakes out there. Oh, the real. Okay, thank you so much. The real Rick Simpson oil. Some of the dispensaries actually offer oil under that name. Not all of them do. And one of the things that can be awfully bewildering to patients at first is the fact that each dispensary has different products. They all have different products, and some of them have different strains. So I should mention that there's basically sativa strains and there's indica strains. The sativa strains in general for most people tend to be described as uplifting and energizing and especially useful for during the day. And the indica strains, for most people, tend to be soothing and relaxing and very good for pain relief and very good for helping with insomnia. So a lot of times people use them at night. And then there are hybrid strains, which may be either sativa dominant or indica dominant. So there's many, many, many different factors at play. In Florida, if you're curious about what the different dispensaries have to offer, you can go to a website called Leafly. That's LEAFLY.com, and it lists all of the different dispensaries in Florida, all of the different products that they carry, and the makeup of all the different products in terms of how much CBD they have compared to how much THC, and what different strains they may contain. And one thing that's very difficult for a lot of people to really understand is that two different cannabis products can give a patient completely different effects depending upon whether those products are the right thing for them or not. One of the things that I've been asked a lot of the time, especially by women patients who are considering possibly using medical marijuana, is a lot of times they're afraid that if they do, it's going to give them the munchies and cause them to gain weight. Fortunately, this is not something that I've seen in my practice. Usually, in fact, if people need to lose weight, when they find the right cannabis products for them, it can help them do that, because if they're eating more due to anxiety or due to depression, and they're having less anxiety or less depression, then they may not eat as much. Not only that, but for patients who have been troubled by pain, reducing their pain has actually enabled them to exercise more, and that's helped them to lose weight. So, this is a truly, truly amazing, I hesitate to call it a drug. It's really a natural herbal substance, but it's considered to be a drug in this system. But it's just so amazing in terms of the quality of life that it has enabled a lot of people to have that didn't have it before. And now, to just kind of wrap up, I would like to show you some of the forms in which people can access medical marijuana, because a lot of times when you say marijuana to people, people just think about smoking it. And although that is a format that has become available in Florida just since last year in March, so it took 2 years from the time that medical marijuana was implemented in Florida to the time that it was available in the form of flower or smokable. But now it is, but that's not the only route of administration that's out there. So I'm going to show you some things from my favorite dispensary, but all of them are good. And in fact, they just left some items here that can help me to show you what different routes of administration there are. So let's see if you can see this. Yes, you may be able to see this. Okay. So this is, let's see if I can open it with one hand. This is a vape pen. Okay. So this one is not filled. None of these items are filled. These are just empty containers, but it helps to show you what different routes are possible. This is a vape pen, and normally it would contain some oil in here. And the patient just inhales from this tip, and when they do that, a battery that's in this end will light up, and it will aerosolize the oil that's in the pen. So, one difference between vaping and smoking, actually, there's two differences, although people tend to think of them as being similar because they're both inhalable. But the difference between inhaling a vape pen aerosol is that what you're doing is you're inhaling little tiny droplets of oil, and the temperature needed to get it to the point where it aerosolizes is lower than the temperature needed to combust the flower that's in, let's say, a joint. Okay, so when you're smoking a joint, you're actually inhaling particulate matter that's at a higher temperature than you would have to for a vape. Interestingly enough, there has not been any research that has suggested that one has a higher risk of lung cancer from smoking even cannabis products, which is interesting and certainly different than that of the risk for tobacco. Here are some other popular ways of ingesting it. You have this syringe here, which normally could contain some oil in this part of it. Okay, and you just push a small amount of the oil in your mouth and you swallow it. And so this is considered to be an oral route of administration. Another oral route of administration is this tincture. So you see it comes in a little bottle, and it has a cap with a, let's see, it has a, you probably can't see it that well. Let's see if I can try to take this off with one hand. I should have opened it earlier, but what I'm trying to show you is that it has a graduated dropper in there, so you can measure very precisely how much you're getting. And the tincture oil is just drops that you use directly under the tongue. You know, different routes of administration will have a different timing of onset and also a different duration of onset. Just to give you some other routes, there is some dispensaries actually even make transdermal patches. So you can peel off the backing and you can stick a patch on yourself for long-term, let's say, pain relief. And then there's also lotions. So you can use lotions which are also absorbed through the skin, and this is great for local relief. So if you have arthritis, like in your hands or something, then in addition to taking a systemic form, you might also want to put some of the cream or lotion right where you're having the pain. So, going back to what I said earlier about the difference between medical marijuana and street marijuana is not only medical marijuana, you know exactly what you're getting. You know, Suzanne, I can't really answer your question, unfortunately, just because I haven't tried that many different products from that many different dispensaries. Maybe Surtero might have been the first one that I tried, and I just liked them so much that I never went further. I do like also Trulieve for their creams. Trulieve has two creams, one of which is almost entirely CBD, and the other of which is almost entirely THC. And the one that I like so much, of course, is the THC. But you have to realize that when you're using a product locally, it doesn't really have systemic effects. The only things that will have systemic effects primarily are those things that are taken systemically, either by vaping or by oral forms or maybe transdermal forms, but you're not going to get high from applying a THC salve to your hands. So, and you know what, it really is so individual, which products will be best for which people. And in fact, people can have exactly the opposite results, sometimes effects from from different cannabis products. Somebody is telling me, Alicia, that Rise is great for tinctures, clean ingredients and effective. I mean, I can just name you some of the dispensaries that are in Florida. There's Curaleaf, there's Trulieve, there's Rise, there's Move, there's VitaCan, there's Grow Healthy. Hey, and a lot of them are probably having sales today. So if you are a medical marijuana patient in the state of Florida, then you may wish to go online and check out your dispensary and see if they're having any sales. And also just to let you know that normally, unlike any other form of medicine in Florida, you can do telemedicine with any other form of medicine in Florida, but not with cannabis in general, okay? But because of this whole coronavirus situation, thank God the Florida legislature has seen fit to enable doctors who certify patients for, yes, that's true. Kath mentions that there's also suppositories. And yes, that is probably the least popular format, but it happens to be very good for some patients, and especially some patients who have cancer and they really cannot, they have no appetite, which is another thing that cannabis can help. Cannabis can help with appetite and with nausea. But some patients are not really able to take it so much by mouth, and so therefore they have to take it by other routes. And so yes, suppositories are another route. But yes, the Florida legislature has, in this instance of coronavirus, seen fit to enable doctors to actually recertify patients that they have originally certified by telemedicine. So I've been doing some FaceTiming lately and some Zoom meetings, and it's really been a pleasure to be able to see some of my patients in their homes. And speaking of seeing some of my patients in their homes, I'm not actually seeing you all out there, but I really appreciate your tuning in, and thank you so much for doing that. Have a wonderful April 20th, and feel free to share this video with anybody who might want more information. And I'll share with you one last reference. This is an article that appeared in the Sun Sentinel. I don't know exactly what was the date. It looks like it was Sunday, June 20th of maybe 2019, but if you search the title, you'll be able to find it. So this is the Sun Sentinel, and this was an article called "Could You Qualify for Medical Marijuana?" And it breaks down the whole thing. Here's the article. And if, by the way, you happen to be somebody who is, not so computer savvy and you want us to just send you a copy, then just contact our office at 954-757-0064, or you can email me at Dr. Ahmadi, that's DRAMADI, at DRAMADI.com. Oh, thank you so much, everybody. I love you too. Take care of yourselves, stay safe, and enjoy the little things in life.